Welcome everybody to the Preparing for the Baby-Friendly Hospital On-Site Assessment webinar today with our presenter Barbara O'Connor. I am Mary Elsner with the Illinois Chapter, American Academy of Pediatrics. I'm the director of the Baby-Friendly Hospital Technical Assistance Project. As you may know, the Illinois Chapter of the American Academy of Pediatrics, or ICAP, is an organization of approximately 2,300 pediatricians in Illinois. Our mission is to promote the right of all children to live happy, safe, and healthy lives and to ensure children receive quality medical care from pediatricians. The Baby Friendly Project is part of the Illinois Department of Public Health's We Choose Health initiative, which is made possible by funding from the Centers for Disease Control and Prevention. As part of the We Choose Health Baby Friendly Hospital Project, ICAP provides technical assistance to We Choose Health grantee communities and the local hospitals that are working to become baby-friendly designated. The manager of the Baby Friendly Hospital Project is Beth Seidel, who will now present the speaker.
Thanks, Mary. We are very fortunate to have Barbara O'Connor presenting our webinar. This is a really unique opportunity for us to learn about the on-site baby-friendly assessment process from an experienced assessor. Barbara has been involved professionally in promoting breastfeeding and human lactation for the past 20 years. She has served as a local WIC coordinator, assessment manager for Baby Friendly USA, and national and international lactation educator. Currently, Barbara is working as faculty for the Healthy Children Project. Barbara co-authored the book, Maternal and Infant Assessment for Breastfeeding and Human Lactation, A Guide for the Practitioner, developed the Grandmother's Tea Project, and provided breastfeeding education for physicians in Latvia and Egypt. Barbara is a member of the Illinois State Breastfeeding Task Force and the United States Breastfeeding Committee. At this time, I would like to turn over to Billy Kalb from ICAP to just talk about some of the logistics of asking questions at the end of the webinar.
Thanks, Beth. Good morning, everyone. I just wanted to give you a quick heads up on how questions are going to be handled on this webinar. Please hold all of your questions until the end, and when we do get to the question part, you can enter your questions via the chat feature of GoToWebinar's control panel. This way, all attendees will be able to see the questions, as will the presenter, and we can address the questions like that. So again, please hold all of your questions until the end, and when we get to that point, you can enter them, type them out in the chat function, and send them to the entire audience so that we can all kind of stay on the same page and see the questions that other attendees are asking. Thanks very much. Without further ado, I will turn it over to our presenter for this morning, Barbara O'Connor. Thanks.
Well, welcome everyone. I'm really excited to be presenting this information with you. First of all, I want to say to all of you, congratulations for being on this webinar. No matter where you are in the process, even if you are just considering starting and beginning the 4D pathway with Baby Friendly USA, you're still light years ahead of so many hospitals in this country. And I have seen so many facilities work so hard to receive the designation that I know this is a tremendous effort for everyone. Practice change is not easy, and so no matter where you are in this process, I wanted to extend to each and every one of you my congratulations for beginning this pathway. And now I just want to talk a little bit about the actual assessment and my thoughts about sharing this with all of you who are at different stages in this process are a couple of different things. First of all, I don't want to frighten anyone by telling you what's at the end of the journey by the on-site assessment, but I also think it's very valuable for people to know what they're getting into. And you'll see, I think, when we finish this presentation today, that this on-site visit and the designation process by Baby Friendly USA is not in any way a punitive sort of process. The on-site visit is designed to see how practice is put into place and to offer to you help and support if they find challenges, the assessors find challenges at the on-site assessment. So what the assessors will do when they come to your facility is look at practice and policy and procedure that you have in place and make sure that it is practice that is set forth in the Baby Friendly USA guidelines and evaluation criteria. Those of you who are not familiar with this particular document, and I know many of you are, this is sort of your Bible as you move through the 4D process. It's available online on the public site of the Baby Friendly USA website. And so if you have not taken a look at it, please do so. Download it and read it carefully. It reads very easily, and it explains what is necessary in order to become a designated facility. So the on-site assessors will be looking at your policy, your practices, and your procedures. And what they will also do is objectively gather information and data. This information and data is gathered via interviews with staff and mothers, via observation of your practice while they're on site, and also via document review. And there will be specific documents that you are required to submit and have ready. We'll talk about those at the end of this presentation. When all of that information is gathered, the assessors then put together a report that is considered by the external review board at Baby Friendly USA. So the assessors do not decide whether you will be a designated site or not. That is done by the external review board. So it's necessary for the assessors during that on-site assessment to gather as much information as they possibly can and to make that information as objective as possible. Just want to talk a little bit about what the assessment team will look like. There will be 2 assessors who come from Baby Friendly. They usually come the evening before your site visit is scheduled, and they will be on site for approximately a day and a half. They'll fly out on the 3rd day, the afternoon or evening of the 3rd day. These assessors have been trained, and they follow very strict procedures that are directed by the Baby Friendly USA office. And they will be utilizing standard forms that are used in every hospital in the United States. So your facility will not have a unique assessment. It will be the standard assessment that's used everywhere in this country. I do want to let you know that they are restricted from providing you any results during the time that they're on site or any suggestions at the time of the assessment. So they feel really uncomfortable if you ask them those questions. I would just encourage you not to ask them, how are things going, or can you tell us anything about the assessment, because they will just absolutely have to say no to you. So let's talk now a little bit about each of the steps and how you can prepare to be ready for the on-site assessment. Step number 1 is all about policy, and some of you have probably already worked through this particular step. It's one of the first efforts that you will make as you travel through the 4D pathway. Writing a policy is extremely important to start off so that you can understand how you need to educate your staff. And having this policy written early on also gives Baby Friendly USA staff an opportunity to review your policy, which they will do for you, and make some suggestions about how you can improve that policy so that it meets the guidelines and evaluation criteria as set forth by Baby Friendly USA. So when the assessors come on site, the way that this will be assessed, the manner in which this will be assessed, is to ask you to submit your most recent policy. You'll probably be submitting that before the assessors actually come on site so that they can read this very carefully. And they will actually do the final evaluation of your policy. So there will be a preliminary evaluation done by the staff as you journey through the pathway, and then that final evaluation of your policy as the assessors are on site. This policy is what is used by the assessors to evaluate your practices as well. So if there is a discrepancy in policy and practice, that will be discussed in the report that is submitted to the external review board. This step is also assessed via staff interviews. So the staff will be asked what they know about the policy, specific questions about policy, and as well as the healthcare providers. So while you're working through this process, making sure that everyone becomes extremely knowledgeable about what's written in this policy is important in order for success at designation, and in order for your facility to be practicing the policies or the procedures that are set forth in your policy. So it's important in several degrees. And then the assessors will be observing practice and comparing that practice to the policy that you have written. One of the things the assessors will ask for when they come to the on-site assessment is a tour of your facility, and they will be looking to see if you have posted the 10 steps in your facility in places where in places that are frequented by women with infants or women who might be pregnant and families. So Baby Friendly USA will talk with you during your 4D process about where those need to be posted, and please make sure that you have those posted, because the assessors will check that with an actual physical tour of your facility. Step 2 is about training the staff. This is one of the biggest tasks, I think, in the baby friendly process, is making sure that all of the staff and the care providers are educated. So when the assessors come for an assessment, they will be actually asking staff about the training that they received. They will be looking at documentation of education of the staff and the care providers, and they will also be assessing the curriculum content that was utilized to educate both the staff and the physicians. The assessors will want to make sure that your curriculum that you're using is including all of the 15 lessons that are set forth by the baby-friendly guidelines and evaluation criteria, as well as all of the subtopics that are associated with those lessons. So it's important for you to be familiar with this early on. What you will want to do, it would be really terrible at the on-site assessment if you presented your curriculum and one of the lessons was left out. So I would encourage you very strongly to take a look at the curriculum that you're using to educate your staff, and take a look at the checklist that Baby Friendly offers you regarding the 15 lessons, and I believe that's on the public site as well, the 15 lessons with the subtopics. And just jot down in your curriculum where you cover each of those points, and if you've made sure that you've covered all of that, then your curriculum will certainly pass the inspection by the assessors. And the assessors will also ask for you to present to them documentation that all of the staff has been educated. So a nice spreadsheet that's very organized with a list of all of the maternity staff that need to be educated, and their date of employment is really important for you to have ready on the assessment as well. This will save a lot of time for the assessors if you have a nice organized way to present all of your staff and the education that they've received. So if we stop for a moment here and just talk about who's going to be interviewed as we're talking about staff interviews and step 2. Regarding staff, the assessors will choose 10 maternity care staff. So that includes labor and delivery and postpartum unit. And they will want to choose staff from a variety of areas and a variety of shifts. And they will not accept a list that you give them saying here are the 10 staff. They will want to see the list of all of the staff that are on duty that day and that evening, and they will randomly choose from that list who they will interview. So there will be 10 staff interviewed, and there will be 5 healthcare providers who will be interviewed as well. Again, offering to the assessors the list of care providers who might be available on those 2 days of assessment and letting them randomly choose is the proper way to proceed with this. So the care providers will be those providers who are actively offering care to mothers and infants. It won't include neonatologists or pediatric cardiologists or those kinds of specialists. The assessors really are looking for the care providers who are working with mothers and babies every day as they come into the hospital. As we move on to step 3, Step 3 covers the education of pregnant women and educating women about the benefits of breastfeeding and the management of breastfeeding. This step is assessed by the assessors via examination of your policy, so they will be looking at your policy to see what you have written as your plan for educating pregnant women. And if you do have an affiliated prenatal clinic, they will ask to interview 10 pregnant women who have received services at this clinic. They will also be interviewing key staff, like the manager of the prenatal clinic, to talk about the plan for education for women. The educational curriculum for pregnant women should include all of the topics that are required by Baby Friendly USA, and again, those will be presented to you as you move through the 4D pathway. And checking your curriculum against that checkoff list that they give you, the topics that need to be included, will help to ensure that you become designated after the on-site assessment, because again, the assessors will use that checklist to go through your curriculum and make sure that the pregnant women are receiving the information that they need. The pregnant women will be interviewed to assess their knowledge of key topics, and those key topics are the benefits of breastfeeding, as you see in Step 3, as well as the management of breastfeeding. And so all of those topics that are listed and required by Baby Friendly USA are prime target for any questions that the assessors will be asking. So as you think about educating your pregnant women, design a plan that will ensure that these women can speak to the importance of skin-to-skin, or why it's important for them to keep the baby in the room with them, or why if they're breastfeeding it's important not to supplement. If you teach your women about these particular topics, you'll find that you have much better compliance in the postpartum unit and in labor and delivery with the practices that you're going to be implementing as you become a baby-friendly facility. In Step 3, it's also expected that the educational materials that you distribute to mothers will be free of any product logo, and so the assessors will be inspecting any educational materials that you hand out to women to make sure that they do have an absence of any product logo. If you have no associated prenatal clinics, then Baby Friendly expects that you will present a plan for how you will provide prenatal education to women who are accessing services at your facility, and that happens in a variety of ways. You can collaborate with WIC, you can offer prenatal breastfeeding classes, whatever you choose to do, but there will be requirement of some sort of a plan for prenatal education, even if you do not have an affiliated prenatal clinic. As I mentioned, 10 pregnant women who have received prenatal services from the affiliated clinic, if you do have an affiliated clinic, will be interviewed. So if there are not enough women available the days that the assessors are on site, I would highly recommend that you ensure the assessors can do their work appropriately by having a list of other women that they might call and interview if the number falls short. Maybe there are only 5 pregnant women available that day, or 8, or whatever. So the number needs to be 10. And these women should be at least 32 weeks gestation or more, and they should have had more than one prenatal visit at the clinic. The assessors will be looking to see what educational information the women have received, and it wouldn't be fair to your facility to interview women who were just visiting the clinic for the first time. It wouldn't be at all fair to expect that these women would have knowledge about the benefits of breastfeeding and the practices that they're going to encounter in the facility by just having one visit. So just want to let you know that those are some of the characteristics you'll want to consider with the women that the assessors are interviewing. Step 4 is a crucial step in all of this process in the Baby Friendly Hospital Initiative. And Step 4 is one of the steps that really applies to each and every mother or pregnant woman that comes into your facility to give birth to her baby. This is all about skin to skin with mothers and babies, especially in that first hour or two after delivery. So the assessors are going to be looking at your practice via observation. They will ask to observe a vaginal and a C-section delivery, if that's possible, if there are any that are occurring during their on-site visit. They will talk to staff about this practice and how it is implemented in your facility, and they will interview mothers about the practices that they encountered from staff. And then they will also take into consideration, of course, your written policy. The mothers on the postpartum unit will be interviewed regarding what happened immediately after delivery and asked to describe their skin-to-skin experience. So as you work through the 4D pathway, ensuring that all of your staff understands the importance through education, and then making sure that all of the staff is implementing this skin-to-skin practice in the same manner, again, will make the assessment just a breeze because it will be second nature to you once you start implementing this practice. The staff and care providers will be interviewed by the assessors to assess their knowledge of the evidence for supporting the practice of the 10 steps. So they will be asked why it's important for mothers to receive this particular practice, regardless of their feeding choice. And then the mothers who give birth to babies in special care, there will be 5 of these mothers interviewed. They will be asked about how they were supported with skin-to-skin by the assessors asking them if the staff has supported offering kangaroo mother care while their baby has been in the special care unit. So this particular step involves babies who have been admitted to special care or NICU. 10 postpartum mothers will be interviewed at your facility, and these will include both breastfeeding and formula feeding if you have any on the unit. I think you're going to be quite surprised by the time you work through the 4D pathway and you're ready for an on-site assessment. You may find that when the assessors come to your facility, you don't even have a formula feeding mother on the unit, and that's fine if you don't. The assessors will not be scurrying to find one. They will be really happy to see that everyone on the unit is breastfeeding. But if you do have a formula feeding mother, she would be interviewed regarding this step. And there will be 5 postpartum mothers who are birth via C-section that will be interviewed. Now these 10 postpartum mothers who birth via vaginal delivery and the 5 mothers who birth via C-section are the only mothers that will be interviewed for all of the steps. So there aren't 10 and 5 for each of the steps, but 10 and 5 completely during the entire assessment. And then 5 mothers total from of infants who were admitted to the special care as well. Step 5 is showing mothers how to breastfeed and how to maintain lactation even if they are separated from their infants. And you'll see that all of these steps are assessed in virtually the same manner. So again, mothers are interviewed regarding how the staff supported their needs about latching their baby on and assessing latch and helping them with feeding their infants. And the staff will be interviewed about their skills, observation of their skills, so they'll be asked questions about latch and asked to show their skills to the assessors, as well as the assessors having looked at your policy and considering how the policy is implemented in your facility as well. Breastfeeding postpartum women will be interviewed and observed breastfeeding their babies. So the assessors will go in and interview mothers into their rooms. They will watch them as they're breastfeeding their babies, and the staff will be asked to invite the mothers into the room when they're helping mothers breastfeed so that the assessors can actually assess and observe the staff utilizing their skills to help mothers latch babies on. Also involved in step 5 is teaching mothers manual expression. And again, this is, in my experience with manual expression, this is one of the tricky skills that staff sometimes is reluctant to take on and to teach mothers. So those of you who are educators in your facility and supporting your staff, I would encourage you to interview your staff about how they feel about this and help to make them feel really comfortable. It's an essential part of the assessment. If the staff is unable to successfully show to the assessors and demonstrate that they can teach mothers how to manually express their milk, you will not be designated as a baby-friendly facility. So if you find that your staff is reluctant in this particular area, please make sure that you give them lots of support and make them feel confident in their skills in teaching mothers manual expression. So the breastfeeding postpartum mothers will be asked what the staff taught them, and then the staff will be interviewed about manual expression and also observed regarding how they educate mothers about manual expression. The mothers who have babies in special care are also part of this step because they are separated from their babies. And so now the facility's ability to support the mother who's separated from her baby will be investigated by the assessors. So they will look at the policy written about how the staff is to support these mothers. They will interview mothers to ask them how they were supported, and they will ask staff how they practice this support when mothers are separated from their babies. If a mother is formula feeding, in this particular case regarding step 5, they will be interviewed regarding how they were taught to appropriately mix and store and feed their baby's formula. So this is, again, one of the steps where the formula feeding mothers will be part of the interviews as well. Step 6 is all about supplementation for breastfeeding babies. And again, assessed very much like the other steps. So mothers will be interviewed regarding whether their babies were exclusively breastfed or not. And if their babies were not exclusively breastfed, then the assessors will be asking about the supplementation, how it was given, when it was given, why it was given, and so on. The staff will be asked about supplementation and what they know about the hazards or the risks of supplementing breastfed babies, how they support mothers who maybe ask for a supplementation. And then there will be examination of the supplement policy. It's really very crucial that a policy is written and communicated to all of the healthcare providers as well as the nursing staff regarding supplementation of breastfed babies. And the assessors will really scrutinize that particular policy and make sure that it is based in the current evidence. Then formula feeding mothers will be included in this step 2 because we will be asking the mothers if they were educated about the possible negative consequences of formula feeding to make sure that they have made an informed decision regarding the feeding of their infant. We've already talked a little bit about staff. They'll be interviewed regarding their knowledge of the risks of formula feeding as well as the importance of exclusivity of breast milk feeding. In the case of supplementation, medical records will be reviewed. I just want to make a little note here to you all about review of medical records. The assessors do not come to the facility and do a chart review as just a general chart review as part of the assessment. The only time the assessors would be looking at a medical record is in the case where there perhaps was a supplementation and they're looking for the documentation for the reason why, the medical order, and the education given to the mother. Or if they find that the mother is reporting practice that she encountered that differs from what policy dictates. And so in that case, they would look at a chart review to see if there's an explanation why practice and policy don't coincide. So there is no general chart review at the on-site assessment. Embedded in step 6 is support for the International Code of the Marketing of Breast Milk Substitutes. And so, of course, you all probably know that it's expected you will not be giving out free formula or free discharge bags from the formula companies. Anything with company logo would not be appropriate to be distributed to mothers at a baby-friendly facility. They will also be looking at educational materials, the assessors will, that are handed out to mothers on the unit and making sure that they are free of product logo. Now, please note that it says product logo. It's not just formula logo that they will be noting. They will also be looking for logos from any company like Gerber or Medela or other companies. Educational information that's distributed to mothers should come from a reputable source, and so it's encouraged that facilities write their own educational material or take something from a university or an organization like the AAP rather than from a manufacturer. During the assessment of Step 6, the purchase of formula by the facility will be assessed as well, and so it will be required that the purchasing agent or someone from purchasing who can speak to the purchasing of formula will be available for a very short interview from the assessors, because you must, at your on-site assessment, show that you have been purchasing formula for the last 3 months prior to the assessment. And I just want to share a little bit of my experience with you here. I have been at on-site assessments where the leaders of the Baby Friendly initiative in the hospital believe and have been told that they're paying for formula, and when we get to the on-site assessment, we have no proof of purchase of formula. The purchasing department actually has not yet been purchasing the formula, and that would withhold your designation. So for those of you who are organizing the assessment, please make sure that those documents are there and that your facility has been purchasing formula for the required amount of time. The assessment of Step 7, which is rooming in, will be assessed or will be examined just like all the other steps. Mother interviews. Mothers will be asked about where their babies were during their hospital stay. When did the rooming in begin? And did it begin immediately after delivery? Has it been 24 hours? And it's expected that as you're moving through the 4D pathway, you will be training your staff to do all of the procedures that are necessary for babies in the mother's room, bathing the baby, doing the examinations in the mother's room. This is a key prime time to really teach your moms about the care of their babies by assessing the babies in the room. And it encourages the mother then to understand that it's important for her to keep her baby close to her as well. So again, Step 7 applies to all mothers regardless of feeding choice. So the assessors will be interviewing both breastfeeding and formula feeding mothers for this particular step. They will be examining your policy to see how you have described to staff they should implement this particular step, and they will be observing where babies are during the time that they are physically at your facility assessing your practices. The staff will be interviewed. Those 10 staff that have been chosen randomly will be interviewed regarding why it's important for mothers to keep their babies together 24 hours, mothers and babies to be kept together 24 hours a day. And if there is a case, while the assessors are on site, where a mother has been separated from her infant, this would be a call, of course, where the assessors would say, we need to look at the medical record to see what's documented, what's the reason for the separation, and how long was the mother and baby separated. Moving on to Step 8, this is the assessment of mothers being taught to feed their babies on cue. And so mothers will be interviewed regarding what they know about when they should feed their babies. And the staff will be interviewed about what they teach mothers, and then the written policy will be examined to make sure that it is explained to staff in the policy what they are to teach mothers. Again, all mothers, regardless of feeding method, will be interviewed regarding education about that they've received about when they should feed their babies, what's appropriate infant feeding, and then, as we said, the staff will be interviewed as well. Step 9 is about deferring the use of artificial nipples with breastfeeding infants, and mothers will be asked who are breastfeeding their babies if their infants have used a rubber nipple, either a bottle nipple or a pacifier. Staff will be interviewed regarding their knowledge about why it's important to not offer breastfeeding babies pacifiers or artificial nipples, and then your policy will be examined as well. If you do use pacifiers for pain control in your facility, that is acceptable by Baby Friendly USA, but you must have a procedure or protocol written so that your staff understands how to use the pacifier appropriately and not to allow the pacifier to go to the mother's room for random use then in the mother's room. If there is a case where the mother's infant does experience the use of an artificial nipple, this again would be a place where the assessors would ask for a medical record to review the charting that's been done to make sure that there's a reason documented, and also that the education provided to the mother is documented as well. And then staff will be interviewed regarding their knowledge of the importance of the implementation of this practice. And as I said, in any case where this does occur, if the mother if the infant needs a supplement and a bottle is used, again, that would be a reason for looking at a medical record to see why a bottle was used rather than an alternative feeding device. And your policy will be examined as well to see if you have written in your policy why you, what sort of alternative feeding method you're using, and how you educated the mother to use that particular feeding method appropriately. Step 10, the last step, is all about how you sort of transition this mother out into the world after she leaves the hospital. And so mothers will be asked about breastfeeding resources in the community. Of course, they won't have to name all of those resources, but they will be asked if they have knowledge of those resources or a document providing them that information. And staff will be interviewed regarding their knowledge of what's available in the community. And then the assessors will be asking to examine that resource list if you do offer a resource list to your mothers. I would, again, offer this recommendation to you that just prior to the assessors coming for the on-site visit, that you take a look at that resource list and call all of those numbers. We've had occasion where the assessors will come in and look at a list and find that, oh, that person hasn't offered lactation support for 2 or 3 years, so please make sure that your resource list is updated. And the resource list must be extremely inclusive. So as you're working through the 4D pathway, you want to start collaborating with your community to understand what resources are available. There are some huge resources available, like the WIC clinics in your area and the Leche League, but there are also small support groups in many communities and independent lactation counselors, and those should all be included in your breastfeeding resources as well. The assessors during examination of Step 10 will also examine your follow-up plan for supportive breastfeeding mothers, and there are parameters in the guidelines and evaluation criteria for you to follow regarding how soon mothers should be encouraged to make an appointment with their pediatrician to make sure that the babies are appropriately followed up. So this is a very quick, brief travel through that assessment of the 10 steps. And so now I just want to talk a little bit about how to prepare for that on-site visit. What will happen as you get closer, some of you may actually have experienced this already, as you get closer to the on-site assessment, you will be asked by Baby Friendly to schedule a readiness interview. And this is a pretty lengthy interview that someone on the staff at Baby Friendly will discuss with you over the phone. You will be invited to offer several people to be involved in this particular call. It probably will take around an hour because they will go through each one of the steps asking you what percentage of your mothers experience things like rooming in and skin-to-skin immediately after delivery and so on. So it's really crucial that you understand where you are as far as staff practice and implementation of the policy. So we would suggest that you go through a chart review perhaps, or interview moms on your floor to give you some idea of where you think you are prior to that readiness assessment. And then this will give you an opportunity to discover some of the challenges that you may uncover with the staff from Baby Friendly, so they might give you some tips about how to overcome those challenges. And you want to make sure that your staff is prepared as possible before that on-site assessment, because it's really deflating if there is a challenge discovered during the on-site assessment. And so making sure that staff is practicing according to the guidelines and evaluation criteria before the assessment is really, really beneficial. It's also costly to have the assessors come out several times to assess your facility, so making sure that you succeed at that first time is beneficial for the financial department of your facility. I would also encourage you to interview your staff to understand what kind of knowledge they've gleaned from the education that's been provided to them. I know that many facilities are choosing to do online education for their staff because it's beneficial regarding monetary costs as well as time costs. But sometimes that online education isn't the most effective in changing practice and helping your staff understand the current evidence basis for the practices, these best practices that are being required by them. So figure out where your staff is regarding knowledge of these 10 steps prior to that on-site assessment as well. You'll after the long interview, then you'll set a date for your on-site physical assessment. And I would encourage you to have all the necessary documents prepared and readily available for examination at the on-site assessment. So those documents include things like the record of the staff education, the names of the staff and the education that they've completed, your prenatal education curriculum, your postpartum education curriculum, the curriculum that has been utilized to train the staff, and any documents that you hand out to mothers regarding breastfeeding education will be asked for as well. Your policy and all the supporting protocols and procedures will be asked to be available for assessment. So just knowing that you need to collect all of those things and have them readily available will actually save quite a bit of time rather than scurrying and looking for those documents as the assessors are on site. If your staff is small, and I have been at facilities that have a very, very small maternity staff, that perhaps when the assessors are then actually at the physical assessment, maybe only 5 of the staff are actually available for assessment, we would encourage you to make arrangements for additional staff to come in for an interview. The interview takes only about 15 minutes, so if staff who are perhaps off on that day at a small facility would come in for an interview so that the number could be raised to 10. That's really crucial. And always prepare for low census. It just seems we have a little joke as baby-friendly assessors that the day that we walk into a facility is the day that all mothers decide they're not going to deliver babies. And we've often walked into a facility where the census is so low that the facility has to make other preparations. Those other preparations would be to have a list of mothers that would be available to come in and be interviewed that have just delivered in the past few weeks, or would be available via a phone interview. And I would say that even if you think you're going to be pretty sure you have mothers available, please still have some names available for the assessors, because it's possible that you will have a really low census. Same in the instance of mothers who are women who are at the prenatal clinic. Have a few extra moms just in case the census is low. You may not have any mothers who have babies admitted to the special care unit when the assessors are on site, and so have a list of mothers to call for those particular interviews as well. The assessors, as I said, will be on site approximately a day and a half. And they will, at the very first morning, arrange an on-site entrance interview. And we would encourage you to invite key players to this entrance interview. There will be specific key players who must be present because there will be questions asked of them, like the CEO and the chief nursing officer, the director of maternity services, the director of the prenatal clinic. Those are key players. But others can be invited to this entrance interview. It's a time for you who have worked so hard to change practice to show off to these key players at your hospital what you've done. So I would encourage you to invite people who you would like to share this journey with. It's really important. I would also encourage you not to schedule an open staff breakfast or lunch. This takes away from the work of the assessors. They really come, they want to do their work. They will often work right through their dinner and their lunch, so please do not expect that they will partake in long presentations from your facility or lunch and dinner with staff. It cuts away from their work time. They have a lot of tasks that must be completed in this day and a half. The assessors will come early in the morning on the first day. They may schedule their entrance interview for 7:30, 8 o'clock in the morning, and they will stay until maybe 8 o'clock that evening because they'll want to be interviewing evening staff as well as day shift. We would encourage you also to create a tentative agenda when the assessors come. Baby Friendly will help you with this as you get closer to the time. They will help you with a lot of this process as you get closer to the time of the on-site assessment. So having an agenda, you'll have 2 assessors, so that means that they will be able to interview simultaneously different individuals. Having 2 rooms, private rooms where the assessors can interview is really important. The assessors will interview without any other staff present when they're interviewing particular staff members. They will also interview without any other staff present when they're interviewing mothers. So if you're aware of that, it just makes the whole situation more comfortable so that you don't stand in the interview and expect that you're going to be able to stay there as a staff member. They will ask that all staff leave the room. Each assessor should be offered a guide from the facility for the entire on-site assessment. They will expect that someone will be moving with them through the facility and also be able to assist them if they do need to access electronic medical records. So be aware of that. And translators should be readily accessible for both the mothers in the prenatal clinic and the mothers on the postpartum unit. The translator cannot be someone who is employed by these units, however. It should be just a general translator for the entire hospital. Phone translation is appropriate as well. Please do not schedule additional interviews. So if you have an expert researcher who works at your facility, it's wonderful that you have that, but the assessors are looking to interview healthcare providers and staff that are working daily with the mothers, and they will not have time to do extra interviews. So please follow the guidelines that will be set forth for you by Baby Friendly USA regarding who needs to be interviewed. And those are people like general practitioners, pediatricians, obstetricians, nurse midwives, and so on. And as we said, have 2 separate private rooms for the staff for the assessors to conduct the staff interviews. Although you might have the intention of offering to the assessors a gift, a sort of thank you little gift, the assessors are not able to take any gifts from you at all. Again, it becomes a very uncomfortable situation when the assessors have to deny those gifts from you, so please don't even offer anything to them. And refrain, again, from asking the assessors how the assessment is going because they cannot tell you anything. The External Review Board makes the decision about whether your facility will be designated. Do not expect that at the end of the assessment, the assessors will do a wrap-up conference with your staff or give you any results regarding how the assessment went. Please be patient for the receipt of your assessment results. Baby Friendly will notify you as soon as they have gotten the information from the External Review Board whether or not your facility has been designated. If designation is achieved, please make this a very, very huge celebration. Each and every one of you involved in this process has put forth a lot of effort, and so you all need to be celebrated. It's a huge PR celebration for your facility, too, so take advantage of that. Invite key people from your community to come and celebrate with you, and invite the newspaper and the radio stations. If designation is postponed, if a challenge is found, we would encourage you also to celebrate with your staff. Celebrate all of those steps that you passed that were found to be acceptable, and then make a plan based on the suggestions from the External Review Board about how to rectify the challenge that has been discovered. because Baby Friendly wants you to receive this designation, and they will offer to you another assessment in the future of just that particular step that was challenged, that was found to be challenged at your facility. So it doesn't mean that there isn't a chance for you to achieve designation if you don't pass the first on-site assessment. It just means that there needs to be a bit more work and a review of practices. Remember that the ultimate goal of all of this is to implement in your facility current evidence-based practice that are good for all mothers and babies. And I can tell you that each and every one of these steps has a load of information and evidence behind it, current evidence to support each of these steps. So I see that we have just about maybe 10 minutes or so for questions, and so I would like to open it up for questions. And Billy, would you review with the participants how they might submit a question?
Absolutely. So on your GoToWebinar control panel on the side of your screen, there should be a box for chat, and you can enter your questions into that field. Just type them out and click send. Make sure you send to all, entire audience, and not just the organizers or presenters. Send it to all, entire audience, and just type them out in that box.
While we're waiting for some questions, this is Beth. Barbara, I do have a question about skin to skin. And I don't know how much detail you can give, but what are they going to be asking the moms about with skin to skin? Is it good? Are they going to look at, was it immediate? Was it uninterrupted? Was there a blanket between the mother's body and the baby's body? Can you give us a little more on that?
Sure, I can certainly do that, Beth. And so the interview with the mother is to examine how the practice was implemented. So all of that would be asked. They will be asked to describe their skin-to-skin experience and when did it start and how long did it last. And was your baby actually skin-to-skin with you? And was there any interruption at all? Did they take the baby away for a minute for an assessment and bring the baby back? And all of the criteria and the guidelines that are in that little booklet the Baby Friendly gives to you that you must meet are questions that will be asked of the mother to ensure that the practice is implemented to the highest standard. Did that answer your question?
Yeah.
Go ahead.
If you were to describe the gold standard for what those moments after birth would look like, how would you describe that?
Sure. So the gold standard would be baby is born and immediately placed skin to skin with mother. Dried while skin to skin with mother, a warm blanket placed over that mother and baby, and then the baby is not taken away from that mother, if this is a breastfeeding mother, until the first feeding has been completed. And when that occurs is to be designated by the baby. So at the end of the first hour, the staff shouldn't be putting the baby to breast, but the mother should report that, oh, my baby started showing feeding cues and looked interested and moved over and latched on. So we're looking for the self-attachment piece. We're looking for no interruption, no move the baby over and weighing the baby. So there's no interruption. All of those standard procedures, assessments, injections, all of those kinds of things can be done skin to skin with mom. There's no need to take the baby away for any of those things. In the case of a C-section, we're looking to see that this starts as quickly as possible. And again, that it's practiced the same way, that there's no interruption until the completion of the first breastfeeding for that breastfed baby. If mothers are formula feeding, if they choose to formula feed, then an hour of uninterrupted skin-to-skin is expected. So in that golden standard, you would see the mother and baby placed skin-to-skin immediately, the baby not taken away from the mother, and the staff will be standing next to the mother, explaining to the mother, oh, look, your baby's showing feeding cues. Now what your baby's going to do is latch on. The baby self-attaches. The baby nurses. The mother and the baby fall asleep or get very sleepy. The feeding is ended, and then other, if there needs to be a separation, it can occur then. But if there's no need for separation, mother and baby remain skin to skin for as long as the mother chooses. So the first question that I see here is how much time do they spend in the ancillary departments? Is there a number of interviews that they need to complete? No, ancillary departments are not interviewed unless there would be a particular question with some sort of practice. The assessors do not go to any ancillary departments. They will go to the NICU to interview moms, but that's the only place other than the maternity unit. And then there was a question about the presentation, and I believe that's been answered if you can access the presentation. If you have only 4 MDs total in your mother-baby unit, 2 OB and 2 peds, if that's all you have, then that's fine. The assessors will only interview those 4. Remember that the statistics are based on percentages. So the smaller number, the denominator, like 4, that just makes it a little more difficult to achieve the goal of 80%, which is most of the goal for all of the steps. In cases where you absolutely cannot get the number 10 or the number 5, the assessors will move forward with that, but it is in your favor to have the denominator that they request. So you said no products with logos. So what we're talking, products with logos, I was talking about educational material with product logo. So if you're passing out to pregnant women or to mothers on the postpartum unit educational materials, let's say you're giving them a handout about mastitis, and it has product logo on the bottom of it. Maybe it's coming from Medela. The assessors will discuss that with you and discuss that with the external review board in their report as well. And it will be encouraged that you do not distribute to any of your mothers educational materials from any manufacturer, but that they come from a credible educational source. And let's see, there's another question down here. Most of the education materials we use are generated within your hospital, okay? However, we do use pumping logs from Medela for baby-friendly. So you would not fail because you have a pumping log from Medela. But let me ask you this. As a nurse, and I'm a nurse, in my professional scope of practice, it doesn't say anywhere in my description that I need to advertise for company. And when I hand out any kind of material that has a manufacturer logo on it, the way that I interpret that myself is that I'm advertising for that company. So I would say that your committee sit down and take a look at the materials that you're distributing to mothers, any kind of support or educational materials. Is there something that you can design to eliminate those product logos so that you are not advertising to your mothers, but that you're giving them just information that they can use, general information with no strings attached? And there are reasons why those companies hand those materials to you or manufacture those materials. It's for advertising purposes. If our practice includes giving a woman a manual breast pump prior to discharge, will this cause a problem since they have? No, if you're giving the mother equipment, that's a different situation. We're talking about educational material specifically with product logo. So it's not the product itself. If a decision is postponed for designation, what is the time for the next site visit? That's determined by your facility. So it depends on what the challenge is. If it's a small challenge that you can rectify and be ready to be reassessed in 3 months or whatever time frame, Baby Friendly is fine with that, as long as they can get the assessors together, a team of assessors to come that quickly to revisit your site. So I can't say that there isn't any set time frame within which you have to have this particularly done. You might have a bigger step that takes a little bit longer to work on. So it just depends on the step and how quickly you can rectify practice and ensure that it's really been corrected and being implemented by all staff. Please. I'm not sure what this next question, please clarify ancillary departments. So I'm going to skip that one and go on to the baby-friendly request to educate ancillary departments. Oh, okay, so I think we're talking about education of ancillary departments here. So any place in your hospital that encounters mothers and babies who might be breastfeeding or a pregnant woman, think about how you might educate the woman if she's pregnant, or how you might support a breastfeeding mother who walks into your facility. And then, according to those services, you want to offer to the staff that might be involved in contact with those mothers some education. And this can be very abbreviated education, maybe just understanding the benefits of breastfeeding for that staff so that they can support that idea with mothers. So, for instance, med-surg unit. What if the med-surg unit has a mother who comes and is admitted and she is a lactating woman? It isn't necessary that the staff on that particular unit know all about breastfeeding. Maybe the most important thing they need to know is that this is the best way to feed a baby, and it's their job to support this mother as she is producing milk for her baby. So the policy or the practice in that particular unit might be that they contact the lactation department at your facility when they encounter a mother who's lactating. So you decide what kind of education they need to support that particular practice that you're going to put in the policy, and then you offer it to the ancillary staff. That's why Baby Friendly doesn't say ancillary staff must have this particular subject involved in the ancillary training. It depends on what their needs are at your particular facility and how you can best support the staff and the mothers and make these breastfeeding women successful to meet their goals. You mentioned that neonatologists, neonatologists will not necessarily be interviewed by the Baby Friendly staff, although they might be. What they're looking for particularly are pediatricians, obstetricians, staff, healthcare providers who are involved in everyday care of mothers of well babies. So it might be that that they do request a neonatologist because they want to explore what's going on with skin-to-skin with mothers and babies in your particular unit. But mostly the focus of Baby Friendly is well babies in the mother-baby unit. And so it would be the care providers who are involved with the daily care of those mothers. They will be interviewing obstetricians as well. So obstetricians, general practitioners, family practitioners, nurse practitioners who care for mothers and babies, nurse midwives. Those are the staff that they're really focusing on. And I believe I've addressed most of the questions. We're actually about 5 minutes past our stop time. So I just want to thank you for all the questions. And thank you for this time. I hope that I've been able to help you at least foresee a little bit of what the assessment might be like. And I wish you all lots of luck. And please don't get discouraged. There are days when this looks like it's a really tough process, but it's something that is going to be so beneficial to the mothers and babies in your facility and in your community. So thank you all for your time.
And Barbara, this is Beth. Thank you so much. This was so very valuable. For those of you who are attending the webinar, if some of the topics that Barbara has talked about is making you think, wow, I would love to hear a little bit more about this topic, I need to know more about a certain part of the assessment, or if there's just any other topics that you would like us to focus on in a future webinar or a networking call, please let me know that. You will be receiving a survey that you can fill out and pass that information along to us. So thank you so much for attending today.